First of all, I would like to talk about the human spine. What is the human spine? Well, the human spine is a complex and unique structure that allows us to walk upright. Okay, and from the perspective of evolutionary, it's considered an advantage that make us prone to mechanical low back pain. Okay, not an advantage, but some people consider it an advantage. So this kind of pain often stems from postural imbalance, spinal anomalies, or even injuries that might disrupt how the spine normally functions. And what I want with this presentation is help you to understand its anatomy, the mechanics, and also explain a little bit of this condition that is so common and how you can maybe manage it effectively. Okay? Now, again, just to remind you, this lecture will be the relationship between upright posture and mechanical low back pain in humans. Okay, let me just start making an illustration of the human body here. I'm gonna do it directly with the pen. I would like to put some music, but the problem is later I'm going to put this video on my YouTube channel, and sometimes the YouTube just remove the video because of the copyrights. But yeah, let's do the best with what we have now. This position is not fully straight, okay? And this is something that you are going to understand during this class. Okay. This is the chest, guys. Kneecap. And here we have the foot. Okay, so here we have a representation of the human body from the lateral view. Now, there is a line of weight that will be... First, let me just finish this skull here. What I'm gonna do? I'm gonna do this. Yeah. Let me just... and then here we have the neck. This is the cervical spine. And here we have the thoracic spine. And here we have the lumbar spine, ending on the sacral spine. Okay? So these are the main curves of the spine from the lateral view. Now I'm gonna do this. Here will be the hip. Here will be the knee joint. And here will be the ankle joint. Okay? So guys, I'm really happy. I finished 60 hours of fasting. 60 hours. That was a lot for me. And quite happy actually, because I wanted this. I wanted to complete 60 hours. Actually, I wanted 72 hours, but it is what it is. We do what we can do, no? Okay. Here is the human body from the lateral view. Now, this one is the line of weight, okay? This one is the line of weight. Let me just write here. Line of weight. Sorry, I just using capital letters. I know that people don't like. Line of weight. But for visual communication, especially here, I think that is better. Don't think that I'm shouting, okay? So here we have the line of weight. And here we have the hip joint. The hip joint. I'm going to use this abbreviation, okay? Hip joint, HJ, knee joint, KJ, and then ankle joint, AJ. Okay, I think that from this perspective, you can have a better idea of the human body at the up straight position. Well, you probably know humans are unique, and among all the primates, because especially because of the walking, on the two legs, this makes us different when compared with the other primates. So this bipedal posture places specific demands on the spine. Why? Because helps to support the body weight while allowing flexibility for movement. Now, in a neutral stand position like this one, the line of gravity, as you can see here, runs through the body in a way that the weight is evenly distributed across the spine and the lower limbs. If I draw from the frontal view, it should be the same, but sometimes it's not. Now, if this line shifts forward or backward relative to the joints, it will create instability and abnormal stress on the spine. So when you see someone with this line, or we can say out of line, you might presume that this person probably suffers from some muscle pain or neck pain or shoulders or even lower back pain. It's quite common. But these are the natural curves in the spine, okay? These are the natural curves. Let me just write here for you. We have the cervical lordosis. Thank you for everyone that is tapping. It's really helpful. This one is the cervical lordosis. Cervical lordosis. This one right here represents this one here represents the thoracic, oh, sorry, thoracic kyphosis. Thoracic kyphosis. Okay? And then below, we have the lumbar lordosis. Lumbar lordosis. Here. So this is for the neck. Neck, upper back, and then the lower back. Let me just highlight this part because I think it will be better to visualize. So here we have the cervical, thoracic, and lumbar. 3 curves here. We also have the sacral, but I will not talk about the sacral today. And these curves develop early in life, and you will notice if you see a baby that will be it will become the development. If you have a child, or if you work with children, you probably will notice that along the life it will be fully established by puberty. So these curves, because this, when you see, for example, athletes, young athletes being trained, they usually have much more flexibility than a normal person. That I mean, a person that is already with the structure established. You have paying all of this, so sorry. Sorry, I'm laughing because it's funny when you say all of this. But yeah, exercise, and for this kind of pain, I highly recommend exercise like Pilates, Tai Chi, and then maybe talk with your physio or osteopath or chiropractor. Are you Brazilian or are you English? Sorry if I, maybe you are Portuguese as well. It's just because usually only Brazilians and English. Portuguese. Okay. So yeah, Pilates, Tai Chi, Qigong. These two practices might sound a little bit odd because are based in movements that we are not used to do, but they are really effective. And yeah, if you have pain all along the spine, might be interesting to look for some help, because I'm not sure about your age, but I presume that you are young. Even if you are in your 50s, it's better take care now than leave for later, because later what will happen is the discs between each vertebra of the spine, they will dehydrate. And you already have spondylitis, 5 hernias, discal fibromyalgia. Yes, yeah. So do something. Even if you have all of this, do Pilates, do Tai Chi, Qigong, even somatic movement. You will notice that in the beginning might be a little bit too much for you. I'm not saying to do all of these modalities of practice movement, but just choose one, and one that suits for your body, and from here you are going to stick with this for the and unfortunately for the rest of your life. This is the price that we pay for injuries that we get along the life. So we need to do something regularly and control the body weight, control your diet, especially adaptation. Some things involve adaptation. And about the exercise, I think that might be helpful for you. Think about it. If you want, I'm not sure if you are living in the UK or in Portugal or in any other place, but in the UK, I used to teach by Zoom a group of people in London. Okay, I used to go to London. I used to go to London every Thursdays, Fridays, and Saturdays. I usually do treatments in London. I have some clients, and then I see the clients in their house. But if you decide for something more movement related, I recommend, if you want, if you wish, maybe I can send I can send a link of my class you can join, and then you can take the decision if you okay, I'm gonna do this because I like it, I think that suits for me. Most of my clients, my clients, they are English, and they suffer from arthritis, rheumatoid arthritis. They suffer from herniated disc. They suffer from fibromyalgia, multiple sclerosis. So I used to work a lot with people with postural issues, pain related, and also neuromuscular pain. Yeah, yeah, yeah. Well, all of these I used to work with. So my background is in physio, sports and science. I also have a diploma in traditional Chinese medicine, which is my major. I used to do this much more. I teach a lot of movement, exercise, Pilates. I have a studio in my house, and I used to teach Tai Chi, Qigong. I'm all the things that I mentioned. I know very well, and I mentioned because maybe you might take the decision of do with someone else, but if you decide with me, it's fine as well. The most important thing is your health. So I think that it's time to, if you are suffering from all of this, don't leave it. Don't, because your body is just uh, being consumed by the pain. You don't want this. Okay. These curves. Why we have these curves? Some people might lose these curves as well. And if they lose these curves, what will happen? Or if they change the line of weight or the center of gravity, what will happen? They will also or increase the natural curves, or they will decrease the natural curves. If they increase the natural curves, they will develop specific issues on the neck, thoracic spine, and lumbar spine. If they decrease the curves, the problem is the same. The thing is, when it's out of balance, you have more force acting in your body. Forces will increase as well, but not evenly. They will focus more in one side than the other, on the back, on the front. This is the point. why it's so important to take care of your posture, because you don't want to create imbalance that will affect one side of the body, and nobody loves to live with pain. This is a fact. Okay, especially lower back pain, that probably, I'm not sure about you guys, but some people usually have such extremous pain on the lower back that they can even wear the pants. I know it sounds strange, but yeah, some people suffer to this point. Thank you for sharing. Thank you for sharing. Okay, I mentioned that these curves help to distribute force efficiently and also maintain the balance. So lumbar lordosis, in particular, protects against sharing force on the lower vertebra. Now, talking about the lumbar spine, thoracic spine, cervical spine, all of these guys will affect the upper limbs, lower limbs, the function of the organs. If you have some, let's say, if your body is out of balance, imagine that we have two vertebrae here. You might suffer some. Doesn't mean that you will, but some people might suffer from compression of the nerve, and this compression of the nerve will lead to pain on specific areas. Okay, specific muscles, specific organs, tissues, even sensation might change. Okay, now what else? Let me see if I find another illustration, because I like drawing. Okay, this is the point. Now, okay, let me do a drawing, but I'm gonna do like this. Let me change a little bit the size of my drawing. You probably saw people in the streets with this kind of posture. Sorry, this part is not perfect. Walk outdoor when you go to the when you go to the park, when you go to the to buy your groceries. Just have a look at people, the way that they walk, their posture, especially when they stand up and stay still. Okay, it's not fully correct here, but I think that it will help you to have an idea. Here we have our center of gravity, and you can see that the center of gravity is not centered, is actually, look the force, look the mass of the body that is projecting forward, the mass of the body that's projecting backwards. Okay, I might say that this person probably suffer from pain on the neck, especially because of this area here. Might suffer with the breath, especially because I'm gonna use the blue one to represent the breath, because there is no space here. You can see that the space is going backwards. Okay, And about the belly, lower back, probably this person will suffer from lower back pain as well. Okay, look at the how different is related with when we compare with the chest. I'm gonna use the orange one. Oh, no, yellow one. And you can see here that the belly protrudes forward. Okay, sometimes the person doesn't have any bloating issues. It's just about the posture. And about the knee, think about, we have the knee, okay, and the knee joint is quite interesting. I will leave this. I will talk about the knee joint another time. But if you imagine that here we have the extremities of the distal extremity of the femur and the proximal extremity of the tibia, and you imagine that they are parallel, which they will not, okay, and this is something that I'm going to explain later. You will see here in this illustration that it because the knee is hyperextending backwards, the person might present a little more of pressure on the front of the knee. Not only the front of the knee. Imagine the PCL, ACL, which are the ligaments of the knee. Imagine the meniscus as well. Okay, so here, and the knee is projecting backwards. Now I'm gonna use the orange. Okay. What else? So the spine is made up of motion segments, and each one consists of 2 vertebrae connected by intervertebral discs, and there are other joints, very complex, but zygapophygeal facet joints. Sorry, when it comes to this part, more with these names, more complex is hard for me to pronounce. But these structures will allow the spine to be flexible and allow flexibility and load transmission. And load transmission, which is the load that goes over the spine. And all of this while maintaining stability. Okay, your body is always like this. Okay, you are always trying to keep your center in some way, physically and emotionally. Let me know if I'm saying I'm telling lies here. Now, intervertebral discs will act as a shock absorber. I don't know what are the vertebrae. I had some vertebrae here. I used it and I yesterday to show some things, but well, let me see if I can find an illustration, a quick illustration here to show you. Okay, maybe I will leave this when I talk about the structure, the anatomical structure of the discs and the vertebral spine. And yeah, but I was mentioning that we have the intervertebral discs between the body of the vertebrae, and these discs will help to absorb and limit the motion between each vertebra. They will not only allow mobility, but they will also limit the mobility, which is important because if you see the vertebrae, they are not fully, they are attached, they have strong, the vertebral column has strong ligaments and strong muscles that will keep the spine stable. But it's only this, okay? And we have an important structure uh, within the spinal canal, that is the spinal cord. So imagine if this just collapse, and what will happen? Imagine what will happen with the spinal cord. And I already mentioned about I've been making videos about the structures of specific structures and fibers, neurons of the spinal cord, how they, if something disrupt the function of these nerves, what will happen with the person, what this person might present. So strong muscles, flexible muscles, work with the balance, okay? Always think about this. Now, ligaments and muscles will play an important role. Deep muscles near the spine will especially support the posture, and the muscles on the surface will enable the movement. Proper, which is something that you might be aware, but proper muscle tone is essential to maintain the spinal curves and prevent strain. So with one can lead to disable conditions. Which one? Which nerve? Um, I think that I'll be honest with you. Now this part doesn't. It's not too important now, because it's some of these things cannot be um, well, unless you remove the pressure, or because I need to understand where is your injury, and for this it's necessary to have a to have a look at your exams, like a MRI, CT scan, especially MRI, okay? And because it's hard to say. It's hard to say. Okay, moving on to the next part. So this is a good posture. Let me just write down here. This is a good posture. And this is a bad posture. And let me know if you want that I send some information about my website. Is on my profile here on TikTok. You can have a look at my website. About the treatments in London, I used to charge different, because from where I live, I need to cover the expense. Now, this is a bad posture. Bad posture. Okay, what else? When we wait a second. Okay, so again, back to poor posture, okay? Excessive curvature, forward head position, rounded shoulders, because when person presents this kind of a position, the thoracic spine, probably the shoulders will be rounded, okay, forward. And hyperextended knees increase mechanical stress in the spine. And what will happen over time? This can cause localized pain due to overuse of other tissues, okay, like muscles, ligaments, and joint capsules. So this is the reason why maintaining a good posture isn't just about awareness, isn't just about aesthetic. It actually, it's much more, and it also requires adequate strength and flexibility to support the spine in its optimal alignment. Now, there are some spinal anomalies, and these anomalies might have an important role in pain. So congenital or acquired spinal anomalies can usually increase the risk of mechanical lower back pain. Okay, and for example, Bertolot's syndrome. Okay, I'm gonna explain about syndromes in the future because, well, this is an infinite topic that we can subject that we can spend years and years studying, and we will always learn something new. Like me, I'm learning now a few new things with you as well. So Bertolot's syndrome occurs when a lumbar vertebra fuses partially with the sacrum, and this will change the biomechanics and will increase the stress over the stress above the affected level. Above the affected level, let's say L5 S1. Okay, so will be above. Now, other anomalies include spine bifida, sorry, spine bifida occulta, which is the incomplete fusion of vertebral arches. I'm gonna show you what are the vertebral arches in another video. We have the hemivertebra abnormality, which is abnormally shaped vertebra, and faced joint asymmetry. And some remain asymptomatic, others can lead to pain usually by changing how forces are distributed across the spine. And leg length difference and pelvic obliquity can also affect spinal alignment and potentially can lead to postural scoliosis or chronic discomfort. Some people are against chiropractic practices, but I truly believe that they do an amazing work. Okay, um, chiropractors are also good. I know that it's not cheap, but might work for some of you. I'm not a chiropractor. I work with traditional Chinese medicine mainly, but I have a background in sports and science and physiotherapy as well, and all the training in massages, different modalities of massage. Let me see what else I can show you here. Ah. I was thinking about draw something, but no. I'm gonna leave it at that. Okay. Let me just illustrate this part. Thank you for the tips, guys. It's really helpful. I hope you are enjoying the content. Okay, so here we have the body of the vertebra. Here is the body of the vertebra. And here you are supposed to find the spinal nerve. Okay? Here we have facet joint. And here the body of the vertebra below the other one. And here the spinal process again. Okay, and let me just write here that this part, we also have here and I'm gonna explain this part later in another video. This is the intervertebral disc, and when we study, you will notice that the intervertebral disc is supported by ligaments. Here we have a ligament as well. Okay, and here we have the interspinal ligaments. Here we have the interspinal ligaments. And this is the supraspinal ligament. Okay, spinal process, interspinal ligaments, because it's connecting the spinal process, and supraspinals because it's above the spinal process. And here we have the ligamento flavum. This is the ligamento flavum. How am I going to do this? Let me just, ligamento flavum. And then we have here the zigo, this joint here, the joint, okay, is zygapophygeal joint or zygapophygeal joint capsule. So these are the structures. To pinpoint actually the exact source of mechanical low back pain. Probably I was mentioned before. It's challenge, especially in clinical practice. And many structures like muscles, ligament, discs, face, joints, nerves, all of these structures can generate pain, and this is the biggest challenge, because the therapist, the physician needs to identify the precise cause, and quite often it's difficult. Okay, it's not easy, but it doesn't mean that the imaging techniques are useless. No, they are great. They can be used to identify abnormalities, but not always will work as we want. Okay, and what happened is quite often clinicians they rely on physical exams. I personally believe that is one of the best approaches. And when we do physical exams, is not only physical assessment, but also we catch information from the patient history. We do provocative tests like diagnostic injections to locate the source of pain. And common causes include degenerative disc disease, osteoarthritis of the facet joints, and dysfunction of the sacroiliac joints. Okay. Disc degeneration typically precedes facet joint arthritis, suggesting, in some cases, a chain reaction of mechanical changes affecting the spinal stability. Now, low back pain, guys, is incredibly common. It's not something that is uncommon, and affect up to 8% to 88%, 88%, 8%, yeah, of people at some point in their lives. And the major cause is uh, uh, it is the major cause of disability, missed work, and high healthcare costs. Okay, maybe because these a lot of therapists are making a lot of money seeing people with these issues. Um, in the US, managing lower back pain exceeds 100 billion annually, and in Australia, 10 billion per year. But research into mechanical lower back pain usually uh, lags behind other health issues. Most cases resolve within weeks, especially when related to acute strain or minor postural problems. But chronic low back pain, you probably, at this point of this lecture, you probably understand that lower back pain is complex and involves physical, emotional, and social factors as well. There are a few treatments considered to this to lower back pain, yeah, and usually physiotherapy, exercise, pain medications, lifestyle changes. I would stick with the physical therapy, exercise, and lifestyle changes, okay? Unless you really suffer from a severe lower back pain. Injections of local anesthetics and corticosteroids into the affected joints can both relieve pain, diagnose as well. And surgery. Um, I'm not quite sure here in the UK, but it's typically reserved for nerve compression and structural instability. I think that they are trying a more um, um, trying to be more conservative. Okay, preserve the structure. So the recommendation might be much more do exercise, which I believe. Okay, that is something that is recommended for most of the surgeons across the UK. I'm not sure. If you have some experience, please share with me here. Now, studies usually show that no operative treatments sorry, succeed in 90% of the case. 90% of case. So this is no operative, okay, guys? No operative. Thank you if you are watching from the For You. For the first time, I've been seeing a lot of people watching from the For You. 63. Ask me how. Okay. And that this is something important. Even when surgery is needed, long-term success depends specifically on addressing biomechanical and psychological factors. Guys, I have to drink some water. And with this information, you already know that it doesn't matter how severe is your lower back pain. At some point, you will need to do exercise. There is no way back. It's not just to sit and rest and wait for the effect of the medications. So you need to to manage and take care of your body. I think that this is the main takeaway from this class. Now, when we talk about psychological and social factors, we need to understand that stress, anxiety, depression, and this is important. I'm not sure about you guys. Fear of movement. It will significantly influence the persistence and the severity of lower back pain. Fear of move. Okay, a lot of people. I've been working with elders, and of course, we need to be. How can I say? We need to be more uh, gentle when we approach this group of people, because most of them, they don't have any knowledge of the body, and they don't understand how important is exercise to control pain. And when they have, for some reason, pain, they decide to just don't do anything. This is not the right approach. I used to work with people with lower back pain that they leave the hospital, and after 2 days they start only arm exercise. There is nothing to do. There is nothing related with the lower back pain. Yeah, there is a relationship, and if you follow me, you will know more these interconnections between shoulders, arms, and lower back pain in the future. But you need to follow me. Okay. Now there is a multidisciplinary approach is important. With that, I mean combine physical rehabilitation, mental health support, vocational guidance, and this is crucial for long-term recovery. Okay, we always need to think about long-term recovery. What else? Yeah, I think that I finished here. So just to wrap up, okay? Mechanical lower back pain is multifactorial factorial condition that is influenced for anatomy, posture, injury, and psychology. We also have social factors involved as well. And the human spine, we know, is strong and can adapt for the upright posture, but the human spine is also vulnerable to abnormal stress, especially from poor posture, from congenital issues, or from injuries and even wear and tear. Okay, and diagnosis usually is important. It is important, actually. A comprehensive evaluation of the patient is important. It's important. So with that, I say that integrating clinical exams with imaging and patient history, it is extremely important for the correct approach of the therapist. And what else? I think that's it. Yeah. What I'm gonna do? Any other drawing? Maybe not. Yeah, I already put a few illustrations here. I think that this helped you to understand lower back pain. But this is just the beginning, guys. This is just the beginning. I'm gonna come back with another video where I'm going to talk about other things related with the lower back pain, especially maybe maybe talking about some possible causes of mechanical lower back pain with or without leg pain. So maybe let me just see something. Yeah, I'm gonna do this and next time. I'm gonna talk about the epidemiology of lower back pain. I had a lot of things to share here. This is a universe and we are going to explore together. Okay guys, I'm gonna finish this live. I really appreciate your time here with me. So if you can follow me, just follow me, and don't forget to share. I'm gonna put the video, the full lecture on my YouTube channel. If you want to check out my YouTube channel, the link is on my profile here on TikTok, and I'm gonna release some shorts of this lecture on my TikTok and Instagram. And if you are looking for help to manage lower back pain, don't forget to contact me. I have my website also on my profile, so you can have a look at my website. If you live in London, I used to travel down to London every Thursdays, Fridays, and actually every Friday, Saturdays, and Sundays. And if you live in Leeds, every Thursdays. Okay? Well, so this is the end of this lecture. See you next time. Cheers.